Today's presentation is ISO-lation, the new reality of the ISO 45001 health and safety standard in the era of telework. I would like to first introduce Carolina De Leon, whom you've already met. She's our section chair. Carolina, do you have any words you'd like to say?
Sure. So just first a welcome to everyone. Thank you for joining us. I see we have a lot of participants. That's great to see. I hope everyone's having a nice year. This is one of our first June meetings, I would say. We usually don't have a June meeting, so I think it's great that, especially virtually, I think it's a lot easier for everyone to be able to join us during the summer. So great to have everyone, and I hope everyone's doing well.
Thanks, Carolina. Are there any other 1510 board members who have any announcements?
Hi, I'm new. I'm the new newsletter editor. My name's Kara Bryan. I was with Nova Southeastern with the ASQ there, got my MBA in process improvement, just like Carolina, and I'm really looking forward to working with everybody. Thank you.
Thank you, and welcome again, Kara, to the board. We really look forward to having you work with us all in this year. And we will have, just to tag on to what Carolina said, this is one of the few June meetings that we've had. It's virtual, obviously, but we will be having meetings, continued virtual meetings through the summer, through July and August as well. Typically, we start our year in September, but we will be just continuing on through in the current situation that we're at with these virtual meetings. Okay, now to our speakers and the presentation. Matt Jess is a DPD, a Doctor of Physical Therapy, and a PSM. Matt, I think that means Process Safety Manager. Is that correct?
Close enough. Yeah, it's actually a designation through the Florida Safety Councils.
Okay, thank you. Matt is Principal Faculty at the Back School and the National Faculty at Summit Professional Education. He's sought after for public speaking and broadcasting and leadership, and he brings verifiable work injury reduction and risk mitigation to business and business to consumer formats. Our second speaker, or co-speaker, is Michael Melnick, who is a seasoned graduate level exercise physiologist and licensed registered occupational therapist. Known far and wide for his high-powered and humorous presentations, Michael's keynote speaking engagements, his extensive video libraries, and his engaging workshops are Fortune 500 favorites. Welcome to you both, and thanks for being with us tonight.
Thanks,
so about tonight's presentation, ISO-lation, the new reality of the ISO 45001 health and safety standard in the era of telework. In 2018, an ISO committee of occupational health and safety experts set to work to develop an international standard. The result of this effort, the ISO 45001, builds on the success of earlier international standards in this area, such as the ISO 14001, the ISO 9001, and the OSHA 18001. Then COVID-19 struck. So what will meeting international health and safety standards look like in the age of telework and telehealth and tele-ed? How can forward-reaching companies leverage the new reality and create something potentially even more robust than what predates it? Find out tonight in this engaging discussion. And as we join the seasoned professionals, Matt and Michael, on how they are employing ergonomics, injury prevention, employee stretch and flex, and safety training in new strategic ways. Learn how telework, telehealth, and tele-ed are not obstacles, but the stepping stones to new standards of both efficiency and effectiveness. So I would like everyone join me in welcoming Matt and Michael. And Matt, I'll turn it over to you. You can go ahead and should be able to share your slides.
Should be able to. So thank you, Phil. I'll introduce my colleague Michael here in just a second. And slide. Do you see the first slide?
Yeah. You're good to go, man.
You've been a great audience. Thank you, everybody. Take good care. Do not forget
to tip. Work the first time.
Yeah. All right, let's try that again. Okay, so now, did you see the slide advance?
Yes.
Okay, so again, by trade, I'm a physical therapist. You heard some of it there, licensed about 30 years, had an opportunity to work at a paper mill as their on-site physical therapist for about 6 years, 12,000 hours. A lot of what I learned there was in work injury prevention. It was basically my laboratory, my playground, and my sandbox, for lack of a better term. And since then, I've been training my colleagues around the country in work injury prevention. So some of the stuff will sound familiar to you. Some of it may sound new. The PSM, as Phil brought up, that's actually just a designation from the Florida Council of, or I should say Association of Safety Councils, because I do confer a lot around the country with different operations. Since that job at the paper plant, I've worked for as national faculty for Summit Professional Education. So I teach CEU level coursework around the US. And I also teach at colleges, universities, trade groups, professional associations. At the university level, it's doctoral level with other doctor of physical therapy students. So some of this will be interesting to you, I hope. I'm going to now introduce my colleague, Michael Melnick. So Michael, can you tell everybody a little bit about you and your background?
Sure. Again, thank you all for being here. My name is Michael Melnick. I am an occupational therapist and exercise physiologist. I have to tell you, this is just a little bit of a confession. As a speaker, I rely on seeing faces and I rely on being able to move. And I'm only able to really do one of the two right now. So I'm going to apologize. I'm at my standing work desk. I'm going to be moving a lot. I'm going to pretend like I can see your faces. But for the last 30 years, I've had a company called The Energized Approach and Prevention Plus, traveling the country, working and consulting with organizations on the areas of injury prevention, the stretching and warm up, the employee training, and those types of things. And then the COVID hit and the world changed. And part of what you're going to see is, at least in part, what our response to that has been, because the world hasn't stopped; it's just changed, and we are accommodating that. So again, I've just been working with organizations. The reason I call it the Energized Approach is, as all of you know, if you're part of an organization, that programs are constantly starting programs, a new initiative, a new program, a new something is being introduced. I get hired by a lot of companies, not because I go in and create the program for them. I go in and go, how do you energize your environment? How do you energize your people around it to make sure that whatever your investment is in the program, you get the maximum return on investment? So it's about how do you sustain programs? And part of what you'll hear again us talking about today is how do you do that when it comes to injury prevention and safety and pretty much any program that's being implemented. So that is who I am. So happy to be here.
Good to have you, Michael. Thank you. And Michael and I do some joint work together. We work independent of one another, and we do some joint work together, which will unfold here as we talk about 45,001 and how we're adapting given the changes we've all experienced recently. I might also mention, you see a cabin behind me here. I'm in the Blue Ridge Mountains right now. I'm using a broadband that basically pings from tower to tower. If I freeze up in some grotesque facial expression, it will resolve in just 15 or 20 minutes, at which point Michael will be doing sock puppets until I come back on. So just wanted to let you know that in case that's what happens here in the rural western North Carolina Blue Ridge Mountains. Let's get into it now. My relationship with Phil has been one I've really cherished. It has to do with the work I do as a credentialed consultant with Florida Makes. Some of you may or may not be familiar with manufacturing extension programs, and you may know that they came from the 1988 Omnibus Competitiveness Act and Trade Bill, because we were bleeding jobs back in the US back in the late 80s, mainly our manufacturing jobs. A lot of reasons, of course, pointed to that, but one of the big ones is something Michael and I are involved in and wanted to do something to change that. And that is healthcare, or what we euphemistically call healthcare in the US, is kind of the red ink on the US's ledger. And to give you a sense of scale, back in the 1950s and 1960s, benefits, which came from World War II, it was something that we gave employers because they capped salaries. It stuck on, but benefits were about 5 to 10% of payroll. So if you had a $50,000 employee back then, which was a fortune back then, they, with benefits and payroll, cost their employer about $52,000, $53,000, $54,000. Now in 2020, benefits are 30 to 50% of payroll. So a $50,000 employee costs their employer $65,000, $75,000. And that extra money is actually 90% of that benefits package is health insurance. So that's what drove a lot of the omnibus trade bill back in '88, which caused manufacturing extension programs to bloom across the US. And to be a credentialed consultant with one is something I'm kind of proud of. And working with Phil at Florida Makes is what came of it. When I worked on site at that paper plant, 1,300 employees, I had a chance to work with the Regional Manufacturing Association. And from there, they became part of Florida Makes. And that's how we all met. So I came through healthcare into manufacturing for about the last 10 years of my career. Now, where we're at today is talking about the ISO 45001. And I know this group knows more about this than I do. So if you allow me just, got a little bit of feedback there. Hello, feedback. There we go. We might have a microphone on or something. There we go. Can you hear me?
Yep.
Okay, good deal. I think there might have been a microphone on or something. Anyway, so as we know, ISO 45000, ISO itself is a membership of 162 national standards bodies, and they represent all the market relevant international standards. It kind of gives us a level playing field, as we know, across international lines. So there's something like 22,000 international standards. And if you want to learn more, they have a great website, they have a great magazine, and they have a great YouTube channel where you can learn more about that. What we want to talk about today is what they rolled out in 2018, late 2018, and that's their 45001 standard, which is their occupational health and safety standard. And it provides a framework to increase safety and reduce workplace hazards across the planet now. And again, we have to think about this in terms of having a level playing field where everybody's competing at the same level. It also helps companies to be involved with this to reduce their costs, which we'll talk about a little bit later. But the 45001 is applicable to all organizations, regardless of size, all industries, and it was designed to be integrated into existing management processes that ISO has been turning out, some of which you're familiar with, I'm sure, like 9001, the quality management standard, and the environmental standard 14001. And everything was chugging along beautifully when suddenly this happened. And we all find ourselves locked in our houses and doing what we have to do, suddenly in a different setting. So Michael and I are going to share with you what we've been doing in the fields of ergonomics. A lot of the work we do can be categorized in that, underneath that umbrella term, ergonomics. So we work a lot on-site and online with employers, corporate accounts, but also we have a whole area that we do teaching this. We teach it to corporate accounts, but we also teach it to providers. Like I say, I teach it at the doctoral level at physical therapy programs at universities, and also at the CEU level through Summit Professional Education. So I like to describe our present healthcare model as Humpty Dumpty healthcare, all the king's horses, all the king's men, trying to put people back together again. It's a model that runs up the tab, and it's rewarded for that. What we, people like Michael and I, are doing are teaching a new generation of colleagues like us to work more in the service of prevention. And that's where 45001 comes in, because there's all kinds of standards now that we can all follow, that we can all look at, and look at things like management processes. In fact, we've been talking with the business advisors at Florida Makes about some of the enterprise assessments they do and how 45001 might apply with them. For instance, they have performance assessments and value assessments. The way we see that through our lens, Michael and I, is how can we help human resource performance? How can we utilize our background to help a workforce perform well at peak performance without any detriment alongside? And we do that in sports medicine all the time. As again, Michael said, he's an exercise physiologist in addition to being an occupational therapist. So we look at that also in terms of the value assessment. While we want to drive down risk factors in environmental health and safety, which of course is a laudable goal, we also want to drive up the performance of the workforce. And these are not mutually exclusive. We want to be able to accomplish both. We don't get a chance to choose between effectiveness and efficiency anymore. Now we're challenged to do this online. We're challenged to do this in this type of format we're doing right now. We're going to share with you some of those, kind of pull back the curtain and show you some of the ways we're doing that. And our goal is to increase the human performance, to mitigate risk, and also improve relationships between leadership and the workforce. And I think we accomplish all three. And I hope by the end of this hour, you'll see that we've done that, and your questions and answers will pertain to that. So what we're going to share with you today is our renewed and new approach to remote ergonomic assessments. We're now doing ergonomic assessments on this format right now. Now, I'm a member of the Human Factors and Ergonomics Society, and some have been doing that for the past 10 years. But we're now really starting to perfect that because COVID has put us all in this situation. We'll also talk with you about ongoing video reinforcement. So there's live, like what we're doing right now, and we call that synchronous interaction, but there's also asynchronous, and that's recorded. And that's Michael's milieu. He has a whole automated system he's going to share with you a little bit and how these two fit together. So we're taking live and we're taking virtual training and digital and video libraries and mixing them with a new live interactive approach that we're talking about right now. I'll give you a little taste of it right here. So when we're out in the field, we're collecting data. A lot of times all we're doing is running around with cameras, taking pictures and taking some measurements and doing some interviews. So when you look at a picture like this that was taken from a live client in Pittsburgh, you can look at the strengths, opportunities, and strategies in front of you. What are the strengths? Well, right off the bat, you can see that the monitor height is properly positioned. It's right at eye level, and that's usually what we ask for. What are the opportunities for improvement? Well, if you'll notice, he's got his reading glasses and he's got all his reading material flat on the work surface. So that may be something we can address. What are some strategies we can use to improve that? One of the things we do is in our live interactive remote ergonomic assessments, we use OSHA compliant information to do that. So this is actually from an OSHA document right here, how to read a document. We load that into our report. And then when that's all done before we actually have the live session with somebody, this gives us a chance to one-on-one talk with them and basically go over what we saw in the photographs and actually maximize our time together. Now, when we blend that with our recordings, we have an ability to preload, to load on the front end and give them material that we'll be expected to talk about when we're live. This maximizes our time together. Afterwards, we can actually apply videos as well, and that's where Michael's energized approach comes in. And I'm going to ask him to step in here and pick it up from here, Michael, and just tell us a little bit about how the recorded video content just dovetails so well with the live ergonomic meetings. And if you'd like me to advance the slides for you, Michael, I can do that.
Yeah, I'll just let you know when I'm ready. So, you know, the beauty of this, and they do say that, you know, when situations occur like the COVID and all of a sudden everybody's working from home and working remotely, that a lot of people kind of freaked out about it. And a lot of people said, okay, wait a second, what opportunities has that created? And as a speaker and consultant, I've been, you know, speaking with companies for 30 years, and I'll get on a plane and I'll fly in and I'll do a 1-hour meeting or a half-day meeting. And the very frustrating thing for me has always been that I'm then getting on a plane and coming home and really crossing my fingers that whatever I said to them in the hour or the 4 hours or the 8 hours that I had with them was really going to stick. Because what I knew all along, and what's been evident forever, is that a lot of the ways in which we've delivered, particularly live content over the years, is not the way that people learn, right? We can entertain them, we can energize them, but if we're actually trying to drive a change in a behavior, we need to do it a little bit differently. And interestingly enough, this whole COVID issue has created an environment not only where we've had to be more creative, but quite possibly we're going to be more effective. So think of it from the standpoint of going, if we're going to be having a person or let's say a department that is going to be having some ergonomic evaluations done in their work area, imagine now that a day or a week or a few days before anything happens, they're getting videos that go, hey, this is an issue. We need to start talking about it. Here's what's going to happen in your world, so that the touch happens before. It's not like all of a sudden I look up over my cubicle and I see somebody with a measuring stick and a camera going, oh, they forgot to tell you? Yeah, we're doing the ergo evals today, or whatever it's going to be. So it really provides this opportunity up front to create whatever kind of conversation, initiate whatever kind of conversation and comfort level that we want. Imagine that a person receives a video and it says, and in this video, we're going to address the most commonly asked questions that people have. So now, if I'm a supervisor in that company, it's now not suddenly on me when an employee goes, well, I have this question, and the supervisor's going, I'm not an ergonomist, I'm not a safety person, I can't answer your question. And it totally changes the flavor of what this whole process feels like. So we have the opportunity on the front end to provide the content, and then on the back end. So I'm just going to go ahead and read this, but the success of an injury prevention program is influenced by the continuous drip of information and the reinforcement of safe behaviors. So what we now have the opportunity to do is literally make ourselves available 24/7, 365 to the audience with whatever topics are necessary. So for example, again, if I said to everybody that's listening right now that I can see, for some of you, the pictures that I can see, the images, some of you've got some postural issues, right? The shoulders are a little bit forward, the heads are a little bit forward, right? It's natural, but it increases the demands. So I could do a presentation and I could tell you about the weight on your spine and the pressure on your back and what's going on with your legs. And you might look at me and go, that's great information. Thank you, Michael. And then I leave. How are you sitting tomorrow? You're sitting exactly the way you probably sat for the last 35 years. But what we have the opportunity now is to drip the reminders. So now imagine that a day after the presentation, and then a week after the evaluation, you're now getting up-to-date information that says, hey, these are the results that we saw from your assessment. Here are some select videos that you can look at that will help you work on the habits that are going to actually drive the safe behavior. We've created tons of videos. Currently, we've got probably, I don't know, like 250 videos. We're making them all the time. But this whole idea of office and home ergonomics, you know, there are organizations now that are suddenly finding out that they've got employees that are working at home at the kitchen table that are having neck pain that is now workers' compensation if they have neck pain, if they're having, you know, if they don't have good lighting in their kitchen or in their living room, whatever it's going to be. And so we've created a whole library to address that. The idea of back injury prevention, stretching and warm-up programs, all of these things are the kinds of programs that have been done when we had the luxury of doing them live. These are what we would come in and do an hour, and everybody would go, thank you, that was really fun. And then what would they do? They would do what normal people do, which is to go back to work, go back to what they were doing. And I think those of us that did it for a living realized that there was a missing piece to this. And once again, there's so many downsides to the COVID, but the one beauty of it is it has forced us to go, how about we drip this content? How about we deliver it to you in a way that actually we know is going to make it a little bit more sustainable? If you just take a look here, and again, this was what was mocked up for our work that we're doing with Florida Makes, but there are opportunities to put any kind of content in here that we want. So we're talking to our clients all the time and saying, what are your issues? It's so easy, you know, either with a phone or a camera or whatever, is to create the content that people want to see. And here's the other piece that we've done. Very consciously, there's no video typically that we put out that's any longer than anywhere from about 90 seconds to 3 minutes. Because here's what we know. We have the attention span of about a gnat right now. And I hope I'm not insulting anybody when I say that. But when you bring employees in to do a 1 hour, 2 hour, 3 hour session, we know for a fact they can't typically stay. There's just no way that they can take in that much information. And then what we know is that there's a limit to how much they're going to retain once it's over. So you've seen the numbers. Do they remember 10%, 15%, 20%? If it's a great presentation, maybe they remember 25%, but we don't even control which 25% they remember. So they may leave going, yeah, I remember he was funny, and I remember he's from Minnesota. That's what I remember. I'm like, that's not what I wanted to have as the takeaway. So now what we're able to do is go, what are the real critical pieces of information? What are the real behaviors we want to get after? And let's drip those on an ongoing basis. All right, you can move it forward again. So if you look at the bottom of this particular one, we've created a whole library for the people that are working at home and waking up in the morning and have no idea why their neck hurts, why their back hurts, why their eyes are tired, why they're going to bed with a headache or whatever it's going to be. And all of those things are actually infecting not just the individual, but also the employer. Because either it's showing up in decreased production or a decrease in the quality of the work that people are doing, or it is going to show up as a workers' comp at some point. And it's very, very interesting, the number of companies that are going, you know, we told employees forever that they can't work at home. We need you here. Well, now, because of COVID-19, they had to work at home, and guess what they found out? People are actually being quite productive, partly because they've got a couple extra hours in their day that they did not have before, in the commute and the showering and in some cases even getting dressed is not taking up the same amount of time. And there are lots of companies now that are going, that's going to become our new normal. We're only going to rent half as much space, or we're going to rotate our workforce through, whatever it's going to be. But they are getting extremely creative in saying, we used to be able to meet with them in the hallway. We used to be able to meet with them at their workstation. We have to find a new way to be able to touch our employees. And that's what this is for. This is saying, in health, in safety, in wellness, in productivity, in whatever the topic is, we need to have a system that lets us feel like we are effectively communicating with our people. All right, Matt. So again, just to show you the kinds of things that we've got in here, all of these not done well or ignored actually have a cost. But just imagine, I just saw, and correct me if I'm wrong, Matt, but I think it was Google that just came out and said they're giving all of their home-based employees now $1,000 to basically buy office ergonomics, stuff, which to me was as much about goodwill as it was about safety. Because if I'm at home and I did not get my new chair with my money, if I bought a boat instead or whatever it was, when my neck hurts, I know that that was my call. It was that the effort was made to get me comfortable, and I didn't take advantage of that. But I know, and this is where I think it's really important as well. But again, and I apologize for my over-enthusiastic nature on this, but this is, what you're looking at here is an addendum to the work that a person's doing, right? If you think of an employee and what they're thinking about while they're working, it is not, where's my phone? It's not, how high is my monitor? They're thinking that I get the report done. They're thinking, so if we do a 1 hour presentation and we never touch them again, they are so focused on getting their work done that safety goes into the back seat until the neck hurts, the back hurts, the eyes are tired, whatever it might be. So we now have the opportunity to say, we get that. So we're not only going to evaluate your work area, remotely, provide you with dripped content, but we're going to do it in a way that takes into account how people learn and know that you're busy, you're working on a report, so it's going to come maybe once a week or every 2 weeks. It's only going to be 90 seconds. It's going to be fun. It's going to be funny. It's going to be engaging. And slowly over time, what we're going to be able to do is start chipping away at the behaviors that are taking a toll on your body. Matt? So again, even when we were talking with Florida Makes and with all the organizations we're talking about, like I said, it's an addendum. Most organizations are not going, we would like to create a business that keeps our employees safe. They're going, we'd like to create a business that manufactures or sells or services, and in the process of doing what our business does, we would like to keep our people safe. But that's not the primary motive. So what we also do, and Matt touched on this earlier, we're not trying to say, make safety and health and wellness the thing. It's saying, let us help you get the health and safety and wellness issues out of the way effectively and without a lot of time and energy, so that what the company is intending to do primarily as their business is now able to be successful. Because we typically get brought in because an organization is going, it's now starting to affect absenteeism. It's starting to impact production. It's starting to impact quality. Well, what are they actually worried about? In many instances, they're going, it's affecting our business model. That's a problem. The way that we do this, which is really important, when you move from live to now virtual, we got to make sure we focus on the experience, right? Because if we don't make it fun and engaging and interesting and fairly easy to do, then we might as well just give them a handout. The difference we have now is to really make this pop. And that's really what this is about, is that they see the initial communication that goes, here's what's coming. It's like, wow, that was really nice. I'm prepared for this. You have the live interaction that Matt will be talking about in just a second. You then have the follow-ups and the drips where they're going, oh man, it didn't take very long. It's helping me change my habits. And it's fun and it's easy and it's effective. So again, this is the model that we are now using. And I think it's going to be the model moving forward, regardless of what happens next with the pandemic. So, Matt?
Thank you, Michael. You know, he brings an automated side to this that we've talked about before COVID, and we've worked together, and all of a sudden it all clicked when at the back school we were talking about doing these remote ergonomic assessments for some time. But everything got pushed to the front burner, so to speak, with this whole event. And with ISO 45001 being this standard, ergonomics, of course, is part of occupational health and safety. And it's often the one that doesn't, well, it gets the short shrift because, frankly, it's not sexy. It tends to be the work-related musculoskeletal disorders, the strains, sprains, aches, and pains. But they wind up being the ones that are recalcitrant, the ones that don't respond well to treatment. So it's funny, at the back school, we get this rash of phone calls at the end of the third quarter every year. Right around September is when everybody gets their experience modification rates, their mod rates from their work comp provider, and they find out their rates are going up again. And it's like, wait a minute, I made sure fires didn't happen here. I made sure there were no amputees, there were no gas leaks. I kept my company off of the 6 o'clock news, and yet my work comp rates continue to climb. And it's those strains, sprains, aches, and pains, what I call the death of 1,000 cuts, that wind up causing this. And that's when the phone rings off the hook for us. Every year around September, people realize they got a budget for next year. So what Michael talked about was the recordings that we can use when we do these live sessions. We do a live session just like we're talking about here, and we're going to get granular here in a moment to show you what it looks like. But what we can wind up doing is actually bookending those live sessions. So I'm going to show you a process of how they can, like videos for Michael, can initiate prior to the live meeting and then also back up and support behind the live meeting. So these things become interchangeable. They become a cyclical process themselves. After the live meeting, after the recorded videos, then we can get one-on-one with people. And this is what the process looks like. Through Michael's automated program, someone can set up with us. We can actually put an email list up for a group of employees and send out to them a intro. Automated email arrives and it says, hey, nice to meet you. This is good to set up your ergonomic assessment. Click on the little blue box there and we'll take you into the process. When they click on that, step one, that brings them to this player, and that can be preloaded with information we want them to know. Sit to stand workstations, hydration, nutrition, exercise, any of the things we want to add. And again, 1 to 2 minute videos. You want to keep it short and sweet. That's where the process begins. If you'll notice on your screen in the lower right-hand corner, you'll see a very simple survey. We keep 3 questions. And the way this process works is, number 1, we need your height. We need your height for your anthropometrics, your seat height and your sit-to-stand workstation height and your reaches and things like that. Just your height. And we have all kinds of data we can draw from. Second thing we ask for is fatigue points. Where do you feel it at the end of the day? We don't bring up things like pain. That's something we learned in clinical life, is pain is a 4-letter word, and it's also a mind virus. If you enter it into a workplace, after a while, people start looking for it. We don't even mention discomfort. Upstream from pain and discomfort is fatigue. So we ask about fatigue. Where are you fatigued, over the course of a day? And then the third thing we ask for is most important. In this process, they upload 5 photographs. Now, everybody has a camera on them nowadays, and everybody has a family member or a neighbor or a peer or a colleague or somebody who can take a photograph from the left, a photograph from the right, a photograph from the back, and one from overhead looking down at the workstation. You're going to see an example here. With those 4 uploaded photographs, and we ask for a 5th one if they can, and we actually ask them to tump their chair over and take a picture of the bottom of their chair. You'll see why here in a moment, but it gives us information as ergonomists as to the adjustability of their chair. So once we gather that information, we're ready to set up their live visit. We haven't even met them yet. And if this sounds kind of odd, this is actually what we do in live on-site analysis anyway. We go from site to site and take pictures. Here's another one. What's the strength you see right here? Well, right off the bat, she's got a good monitor height with her sit-to-stand workstation. I actually issued this station at this particular employer. What are the opportunities? Well, it looks like she's got 2 cell phones on her right. She's got a landline on her right. She's got everything loaded on the right side, so she's overloaded on one side. This is the type of person that might see us in the clinic later with a carpal tunnel or an epicondylitis or a bursitis or a thoracic outlet. And if we didn't see this photograph of their workstation, we would just be chasing rabbits as far as trying to work on their condition. So having this information makes clinicians better clinicians as well. So what are the strategies when we see something like that? Well, again, we draw from OSHA compliant data. So when we deliver an assessment, it is OSHA compliant. It lives up to their standards. And this is just an example of where we draw the information from. Now, once we do that, we're going to set up this live meeting with them and actually go over the assessments. You're going to see an example here in a second of what an assessment looks like. And then lastly, through Michael's automated program, we're able to also have backup videos on the other side. Hey, remember when we talked about adjusting your workstation? Remember when we talked about making sure your monitor height is such, and remember this, remember that, so that it is perpetuated. You have the live interactive and you have the asynchronous or recorded material, both supporting one another. That's what makes this all stronger than what we had in the past. And that's frankly what this whole COVID event pushed us forward. We're actually going to move into perhaps more efficient and more effective paradigms or models, if you will. So we're taking these live remote ergonomic assessments, we're blending them with this ongoing video reinforcement. This gives us training opportunity in human resources and environmental health and safety, both live and virtual. And we have this whole library that Michael just described to draw from. This is what drives human performance while mitigating risk and improving workforce engagement, recruitment, all of the above, the relationship between upper management and the workforce. So when I said initially, we're not just mediating risk here. Of course we are. The environmental health and safety aspects of this are some of the strongest, but we're also utilizing this opportunity to work with people on things. The ergonomics just winds up being the entree. That's really just let us get started. But if a person, an employer wants us to talk with them about hydration, nutrition, stress management, exercise activity, working through the workday, we can cover all that health coaching and job coaching as well. So again, working with Florida Makes and their enterprise assessments, we see the performance assessments in helping the human resources side of the equation, while also the value assessments in driving down the risk. And when it comes to 45,001, there are standards. There's a whole list of standards I downloaded from ResearchGate and looked over all of them. I plucked a few of them out here just to touch on as we've been going along. One of them is continuous improvement. And one of the things I learned from working in manufacturing is everybody talks lean. So we bring our approach through the lean lens, through the continuous improvement. That's why it's great to address this group of process improvement masters. You guys are the ones we turn to. We're novices at this, but we know that this is the best step forward for what we have to deliver. So very simply, and I know this is probably kiddie school stuff for everybody on this call, but on the screen there, you see we use the 5 why root cause analysis. This is nothing but sports medicine. It's what we do in the clinic. And we drill down to the root cause. Once we find the root cause, we can't ask why anymore. Then we engage the Deming cycle in the center there, the plan, do, check, and adjust continuous quality improvement model. Once we engage the Deming cycle and it's doing its thing, we're dragging behind it that wedge that looks like standard work, that red wedge there. We're changing the standard of work. And as you all know, this is Kaizen. That's a Japanese word. That Kai means continuous, Zen means good. This is continuous improvement. What this looks like and what we deliver under the auspices of 45,001 or not is very straightforward. Number one, we have the plan, do, check, and adjust model. What you're looking at on the left-hand side of your screen is an actual floor plan from an employer where we were given, and this is normal for us. We'll get a call that says we have 25 office ergonomics we'd like you to do for us. That's great. We'll be happy to. You have one day to do it. So what you're looking at is a floor plan of an actual client of 25 workstations, which means you got 15 to 20 minutes to do each workstation. Now in that time, all you're going to do with your Deming cycle is the left side of the Deming cycle. On site, you're going to be doing data gathering, the plan and the do. You're going to be interviewing, observing, and measuring. Interviewing, observing, and measuring. Maybe giving some guidelines, but moving from station to station every 20 minutes. Then you're going to go home and complete the right side of the Deming cycle. The check is where you're going to use your assessment tools, your REBAs, your RULAs, your Rogers, all of these different tools to which you're going to then write up your report. And that's the adjust section. That's where you're going to provide all your strategies to improve outcomes. So that's what this is going to look like. And this is what we've been doing live on site. Now what we're doing in this setting is we have to preload this process. And if we're doing industrial ergonomics, we actually can do it by employing the people who are already on site. We can actually ask the people who actually work there, if we're working with them this way, and it's an industrial setting, we can say, listen, I'd like you to go out and get these measurements. I'd like you to go out and get these photographs. If you gather the data on site, Then we have this session together. We'll go ahead and do the processing and write up the report. And then we'll meet with you and the employee remotely like this and actually train them up on it. I'm gonna give you some examples here in just a second. Just so you know, we didn't pull this out of a hat. This is actually the process we've been following since 2002. This is a paper from the International Archives of Occupational, Environmental, and Health, and it's a 4-stage process. And as you can see, stage 1 and stage 2 are data gathering, stage 3 and stage 4 are data processing. When we're doing it in the telehealth model, the remote ergonomic assessment model, we have to preload all of that stuff. So we have to get the information first. And you saw that example that we showed you earlier with the form filling out at the beginning. We need the height, we need the fatigue points, and we need those 5 photographs. And from that, we can draw up a very, very surprisingly good report. So what does that look like? Let me give you an example. This is what a real report looks like. The type of information we ask for, like I said, photo from the left, a photo from the right, a photo from the back, a photo from the top. And if you can, show us the bottom of your chair. Now, when we gather that information and we have that person's height and we have their fatigue points, we're simply going to go through that very simple strengths, opportunities, and strategies process. And we're going to use the best OSHA compliant assessment tools out there. This happens to be from Cal OSHA. And as you can see, there's a checklist right there. We're going to go down that checklist from those 5 photographs, because that's basically what we do when we're live and we have to go on site. All we're doing is collecting data. So once you have that data, you're going to check anything that checks yes on that questionnaire is going to be a strength. Anything that checks no on those questionnaires is going to be an opportunity for improvement. And finally, once you've identified those opportunities for improvement, you are going to look up the strategies. This is an open book test. This is paint by numbers, but it actually develops a very good ergonomic assessment. And we haven't even met the person yet. Realize this is all done front loaded. So this is what the report looks like. We've basically dragged and dropped from that OSHA document in here, from the photographs you see there, and you'll notice the photograph of the tumped over, as I like to see, chair. So we can describe the adjustments of the chair right there. There's a list of, now we've summarized, those are summaries of what it said in the OSHA document, but basically everything here is OSHA compliant, and that's page 1 and page 2. When you get to page 3 and page 4, you see the opportunities. These are the opportunities for improvement we identified from that checklist on that OSHA assessment tool. And then finally, we list the strategies for improvement on pages 4 and pages 5. And if you'll notice at the very bottom of page 5, you'll see the anthropometrics. Remember I asked for his height? Well, that height we then use to, and there's all kinds of scales, and we're like, okay, your monitor needs to be this high, your chair needs to be this high, your armrest needs to be this high, and we help work them through that live. This is all done before we've done the live session. Then in the live session, we go over this document. That's how we maximize the time. That's how we make the time effective and efficient. And then we can give them the document afterwards, but we go over it with them. This allows us to manage the change that COVID has basically dropped on us. We're now moving beyond office ergonomics, which frankly is kid stuff. That's the paint by numbers stuff, into industrial ergonomics. So when we have people out there that can gather our information for us, when we work with an employer and say, look, I'd like somebody on your safety team to go out and gather, like for instance, this machinist who carries around, if you'll notice the picture on the right of your screen, look at that key ring right there. So part of his rounds is to go around and do field inspection, field maintenance, and field repair all morning long. Now we happen to weigh that bag he's got hiked up on his shoulder right there. And that bag, that's a digital force gauge you see right there, is 67 pounds. Imagine toting that around with that bunch of keys there and going from workstation to workstation and maintenance. We look at a document and information gathered like that and go through our strengths, opportunities, and strategies process. Again, this is all processing. Utilizing our Deming cycle, we're going to make sure that the left side of the Deming cycle, the plan and do, is the data gathering phase done on site by people who work with that employer. We're going to handle the right side of the Deming cycle. We're going to handle the check and adjust side of things. Now, this is a different OSHA compliant tool. This is a different OSHA compliant tool. So you'll notice strengths are going to be on these 2 pages right here. Opportunities, anything that's checked no, we're going to check those off from the data that was given. And then finally, strategies will be looked up in this part of the report. But the same thing applies that we did in Office. We're dragging and dropping the pertinent information on there so that we can write up a report. Now, this means we have to rely on the people who work there. And we're pretty confident after being around the country and working with a lot of environmental health and safety professionals, a lot of HR professionals, there's plenty of people who can do this data gathering, especially with a little coaching from us. So when we ask who the expert is, it's not really Michael and I. The expert are the people in the field who do it. We just ask them to gather our data, and then we'll process the data and make recommendations for them. So this is a live report. This is what it looks like. It's a little different than the Office one, of course, but it has the information from the interview we did with them live, just like we're doing here, and information we dragged and dropped from the OSHA document, the OSHA compliant document, the strengths, the opportunities, and the strategies. So, and we use the OSHA hierarchy of controls. So you see elimination, substitution, engineering, and then a whole lot in administrative and in personal protection, recommendations, so that these people can actually take control of it. And we give them ideas and challenge and strategies to reduce this type of exposure. This is a very simple one. They get more complex, but with sophistication and with doing this more and more, and the people we work with, we raise them up in their sophistication level. And this allows them to isolate what's out there for them. So we may give them recommendations like, hey, do you think you might be able to get something on wheels? Do you think you might be able to use a bucket, for instance? This is just a picture of somebody's work bucket that was 40 pounds. Still not great, but at least we're showing improvement that way. So when we bring this all back to ISO 45001, we realize that we have an opportunity to reduce workplace incidents, reduce absentee and turnover, reduce costs in those insurance premiums I brought up, create a healthy work culture, reinforce leadership commitment, legal and regulatory requirements are also in there, and enhance reputation and morale. So that's what we're doing here. This system was designed, as we know, over 70 countries, had a hand in it, and that's really the takeaway here. If we're going to have a level playing field, that's where ISO comes in, where we can all say, listen, across international lines, this is what we're doing. This is the standard that we're all working with, and this is our approach. This is our contribution using ergonomics to do that. We're simply using a sports medicine model, applied lean ergonomics, we call it, plan, do, check, and adjust, the Deming cycle. It's the stuff we've always done on site, but now we're incorporating preloading for office ergonomics, and we're incorporating people who are on site for industrial ergonomics. And with that, Michael, do you want to sign off a little bit? We'll wrap up here and see if there's any time for Q&A.
I think just open it up for Q&A, whoever's sticking around, and I certainly appreciate your time. And yeah, let's just open it up and see if anybody's got any questions or thoughts.
Well, thanks.
Okay,
thanks,
Phil.
thanks, Michael. Thanks, Matt. Thanks for that presentation. And we could take a couple of questions, but since we have so many people in this conference, we have 61, I think was the last number I saw. If you've got a question, if you could just indicate in the chat that you have a question, you don't have to write the whole question there. Just tell me you have a question, and I'll call on you, and you can ask it, ask it live. So I'm waiting to see if I see any. I do have a question in the meantime if I don't see any from anyone else right away. But what's been your experience? I know the COVID situation, the stay at home has been relatively short, 3 months now, I think about. I know that's what I've been spending at home. What's been your experience with any telecommuting situation as far as, workers' comp? I mean, how hard or how easy is it to show that there's a connection between a workers' comp claim for a telecommuter as opposed to, sitting in the office or working on the floor at the employer's site?
Boy,
Go
ahead, Michael.
Well, what I can share with you is I work with a number of large insurance organizations. It's a little bit early to say what all the numbers are and exactly how it's going to shake out. But what I will tell you is for lack of better terms, they're kind of freaking out. And I mean, they are doing backflips to make sure they've got the documentation and the process in place, because they're anticipating a worst case scenario, which is I'm upstairs in my house and I'm going to go down to my kitchen where I'm going to do my work at the kitchen table. And if I trip on the stairs on the way down the stairs, that is a workers' compensation, claim. So they are anticipating that there's going to be a lot that comes out of this. So again, I think it's premature to start counting the numbers, but at least the groups that I'm working with are acting as if it's going to not only be hard to differentiate what was work and not work, but that it's probably going to lean towards the favor of the employee in that situation. Partly because there's going to be a lack of hard data. So it's going to be he said, she said, or whatever. So they are aggressively working on their protocol for how to handle that.
And if I can add on to that, I wince when Michael says, and he's right. I mean, Google is going to throw $1,000 at every employee, buy your own stuff. Boy, I sure hope they did their homework. Boy, I sure hope they cataloged and said, no, you get to choose from this list, because there's a lot of nonsense out there. There's a lot of nonsense. And we encounter it all the time at the back school. Should I get a Swiss ball to sit on at work? And we're like, no, don't sit on an exercise ball at work. Okay. Or the walking treadmill. And for anybody on this call who has those things, God bless you. I don't mean anything by it, but if your exercise ball bursts, it's a comp, it's work comp. If you're working on your treadmill desk and you stumble on your shoelace, it's work comp. So it's to just add on to what Michael said, it's kind of a brave new world out there right now, Phil. It's really interesting.
Okay. Well, I want to thank you again. We are at the end of our time here, but I enjoyed listening to the presentation, watching the presentation. I do want to, thank you again, Michael and Matt, for presenting tonight. We really appreciate your participation here.